Thanks, Ceann Comhairle. I think with limited time we kind of have to cut to the chase, and I think if we want to deal with the problems in our health service, the starting point has to be the disbandment of the HSE. It's now very much part of the problem, not in any way part of the solution as far as I'm concerned. It, as an organisation, is absolutely irreformable. And I don't say that lightly or flippantly. I think in actual fact from its inception it was what Maeve Van Wren described as a reform in health administration. But it didn't get to the problems at the heart of our health service, which is the two-tier nature of our system. And in actual fact what the last government did was, rather than address that, added to the problem by frog-marching everybody over the age of 35 into a system of private health insurance, whether they liked it or not. And it's not the best outcome, and our citizens are paying the price of that, because the two-tier nature of our system is at the heart of the problems. Problems which see nearly 500,000 people, 10% of the entire population, are waiting for various forms of treatment or assessment in the public hospital system. Over 10,000 children, sick children, are waiting for an appointment in the public system. And we know the figures that 300 to 350 Irish patients die every year because of overcrowding in A&E. And that's not the people, not to mention the people who mightn't die if they hadn't committed suicide because their mental health issues were addressed previously, the obese people, the people with heart problems and so on, because of the lack of attention at primary care level. And I do think that the only solution is a single-tier, publicly funded public health system. It's the best value for money, and it is the best outcome for patients as well. It's somewhat ironic in some ways. 68.5% of health spending in Ireland that's public is way below the OECD average of 72.7%. But that said, I do think that there's a lot of money in our system which we waste. It's not going to the front line. We're not prepared to pay our nurses, but we are prepared to pay over the odds for agencies. We're not prepared to provide public nursing home beds, but we are prepared to give away a fortune in tax breaks and handouts to private nursing homes. And we've walked away from proper services for our citizens, young and old, who are disabled. And I just want to spend the few minutes I have about that, because there's been an explosion of organisations which are there to deal with providing support for citizens with disabilities, each with their own CEO, each with their own Director of Finance, each with their own office, and each with all the plethora that goes with that. But the money isn't going into the front line. And the middlemen problem that has existed in Irish society is actually very much alive and well in our health services. Now, a recent paper from Trinity College in relation to disability services said that these services in Ireland paint a consistent picture of poor or non-existent implementation over several decades by voluntary and statutory bodies of the changes that are required. And as a result of that, over 900 HIQA inspections into residential disability services found that 93% didn't comply with national standards. Now, I'm sure you're aware, Minister, that in your own constituency, as in mine, there's now an acute crisis in the provision of services for young people with disabilities, particularly young people with autism who are transitioning from a school environment into after-school services. And there is nothing there for them. Almost 100 young people on the north side of Dublin who had been told that they would get access to services like the GEAL service provider have now been told that there's no places in that organisation for them. That was a more high-quality type of care that's been downgraded into other lesser qualities of care, Praxis, which doesn't give us much hand-on training, and other organisations. But no parent now knows what facilities their young people are going to transition into. And as you know, for autistic young people, they need routine, they need reassurance. Anything that falls apart in the system has a massive impact on them, and it's just not good enough. We're spending a fortune to these organisations that are sort of to the side of the HSE. They're not being checked, they're not providing the services to the individuals who need them, they're costing society more without giving the person at the heart of it, and it is only going to get worse while this model remains.
Thank you.